This is Operation Takeover.
Can you guess who today's hero is? Well, I'll give you a clue. They like to wear these at work. They sometimes use one of these.
And they get to work using one of these.
Actually, Xand, I was going to say they use a lot of this.
What?
Yep, you guessed it. We're about to take over the jobs of today's heroes, firefighters Andy and Gemma. Fires can destroy homes and even lives if not attended to quickly. Firefighters aren't just qualified to put out fires. They're also medically trained to treat any casualties.
What sort of emergencies are you trained to respond to?
We go to small fires, big fires like buildings. Then we go to lots of car crashes. We go to spillages of hazardous substances, floods, all sorts of things where people need our help in the fire service.
Firefighters often treat people before the paramedics arrive. This is Andy's medical kit.
This is what we call our trauma pack. We have an AED for people that have had a heart attack. It gives them electric shock to hopefully get their heart back into a normal rhythm. Carry oxygen and masks in here for people that have breathed in smoke. In here is cling film, which is a perfect dressing for somebody who has been burned. And then bandages and tourniquets for bleeding.
Let's take on the challenge.
Are you ready, Xand?
I can't see a thing.
It's time for us to take over as firefighters.
So behind you, you've got a burning building. Your challenge is to get off the fire engine, to get the correct equipment on, and into that building, search for a casualty, bring them out and treat them using your first aid skills as appropriate.
I'm feeling a little nervous. Before we get going, firefighter Gemma reminds us what we're getting judged on.
First will be our arrival at the scene.
We anticipate that we will get to every house fire within the West Midlands within 5 minutes. So we have to get dressed, get the vehicle to the house fire and be dressed and ready to go.
Second, how quickly we find a casualty.
It's really important when we go in that we stick together as a team. Communication is an absolute must and never go any further than an arm's length away from each other. It's dark and it's smoky and it could be really hot if there's a fire in there.
So we may not be able to see.
No.
And finally, how we treat the patient.
If somebody takes 2 breaths of smoke in a fire, then they could become unconscious. So it's a really, really dangerous environment. Rescue of life is the most important.
Gear on, and the challenge starts.
Right, Xand, the most important thing about being a firefighter is staying cool, calm and collected. Have you got that?
Time to go in, Chris. Let's see what you're made of.
I'm all over it, Xandy.
Good work. Chris arrives at the scene and is out of the fire engine quickly.
We've got a house fire, quickly as you can now.
You got it, Andy. Fireman Chris to the rescue.
There's a casualty in there, OK? Stay low if it's hot.
Gemma leads Chris into the burning building, and there's thermal infrared imaging to bring you the action. Chris, are you listening to instructions?
Xand, I can't see anything in all this smoke.
You're not communicating much, Chris.
Yeah,
Thank you. There's the casualty. Time to get him out safely and treat his injuries.
just come over here. I have a seat here. Okay, let's get the action on you.
How are you feeling?
I think I've broken my arm.
I think you've broken your arm. Okay, just keep your hand up there. Do you know what day it is?
Monday.
Is it Monday? You're more orientated than I am anyway.
Come on, Chris, get with it.
All right, all right. Anyway, it's your turn. Let's see how good you are.
How do I open the door? Am I going in that door?
Come on, hurry up, get off the fire engine.
Where is it? Oh, there.
Seriously, Xand, you've lost loads of time trying to find the door.
Follow Gemma in the house. Find that casualty for me and bring him or her out.
Can't see a thing.
It's really difficult to see anything in the smoke.
You're not kidding, Xand.
Is anybody here? I can see I'm shouting for help. Okay, we're coming.
Good communication skills, Xand.
All right, we've got you.
And you located the casualty quickly. Well done.
OK, take him over to the casualty area. He'll need treatment.
That's good. Come this way.
Now let's see how you treat his injuries.
Get your oxygen on you.
The casualty has got burns on his hands.
Okay, let's have a look at his stats first of all. Oh, I didn't turn it on. How's your hand feeling now? Should we get some cling film on that as well then? That is extremely stressful.
Challenge complete. It's time for the verdict.
First up, Andy judges our arrival at the scene.
Xand, there was a little bit of a delay because you couldn't open the fire engine door.
How do I open the door? Am I going in that door?
How long was that, 10, 15 minutes?
It was fine. I got out.
Gemma judges us on how quickly we found the casualty.
Chris, when we went inside, you were a little bit rabbit in the headlights. You were quite nervous, weren't sure what instructions to follow.
Rabbit in the headlights is never a good thing.
Finally, Andy judges us on how we treated the patient.
Once the casualty was out, you were both equally good treating the casualty. You make good doctors.
Well, that's a relief, given we are doctors. But who was the best firefighter?
What's the verdict?
The winner is
Chris.
Chris, well done.
What lets Xand down?
And not being able to get out of the fire engine.
Right.
Kind of like a basic firefighter skill to be able to open the door.
Well, Xand, I may have beaten you, but I think we've both learned that being a firefighter is not easy, and I think it's probably best left to the professionals. We should hand back our helmets.
Thank you very much.
This is Operation Takeover. Can you guess who today's hero is? Well, I'll give you a clue. They might use some of these.
They're a gardener.
No, Xand. You might find them using some of this.
They're definitely a gardener.
No, Xand. OK, last clue. They often use this stuff.
Are they the head gardener?
Well, I suppose they are in a way.
Did you guess it?
We're about to take over the job of today's hospital hero, volunteer hairdresser Andrew.
He's the top stylist to the patients at the Chelsea and Westminster Hospital in London.
Probably not many people think of hospitals as having hairdressers. Why do you need a hairdresser in a hospital?
I just think a bit of normality in the midst of everything that they're going through is just so important. So getting a haircut, and some people have not had their hair washed for days or weeks or months, and the guys haven't had a shave, so not being able to do that must be so frustrating.
One person in need of Andrew's services is 16-year-old Naylor, who's desperate for a quick trim.
I mean, the important thing for me is I want your hair to look great, but I want you to be comfortable as well. So are you OK to stand while I cut your hair? Yeah. Would that be all right?
So, Naylor, is it good that there's a hairdresser in the hospital?
I was actually quite shocked, but it's nice to have, you know, especially if you've been here for like a long time.
Tell us a bit about the technique of what you're doing.
OK, so I'm just cutting it, just getting all the dead ends off. I'm cutting a couple of inches off, and I'm just keeping it one length, just keeping it really neat and really classic and simple.
A few more snips and nips later, and Naylor's ready to go.
Let's have a look. Just feels better as well.
You look great when we arrived, but you do look even better
Absolutely.
Oh, thank you.
We've seen just how important and challenging the job of being a hospital hairdresser really is.
That's right, Chris, and I am really looking forward to this challenge, but I'm a little worried we might not make the cut. Get it? Like the haircut, like the scissors.
It's time for us to take over as hospital hairdressers.
Andrew, what is our challenge today?
I've got 2 volunteers who want their hair cut and styled.
Are these sort of dummies wearing wigs, or are these real human
No,
beings?
these are real people with real hair, so they will be a bit nervous about cutting too much off, and they know how they like to wear their hair, so that's all part of the challenge.
No pressure then.
Yikes!
We're going to be judged on consultation, speaking to the client and asking what they want done,
Technique, how we cut and style the hair.
and the presentation, the final look, and making sure the client is happy. Eek.
Uh-oh, I feel slightly worried for our 2 very brave volunteers, Lizzie and Cassie.
I'll go first. Watch and learn, Xand.
OK, so show me how much you'd like taken off the end.
Perhaps an inch or two.
Like now I'm trying to look as if I'm like really like weighing up the options and deciding what cut I'm going to give you, but actually I'm just stalling because I'm a bit nervous.
Maybe he shouldn't have said he was nervous. That might not be the best thing to say with a pair of scissors in your hand.
Consultation done. It's time to get snipping.
There we go, the first cut. I think less is going to be more here, Lizzie.
I'm just going to do a tiny bit more.
Yeah, I'm not sure Andrew taught us the zigzag technique.
As they say, it'll always grow back.
I'd be worried too, Lizzie.
What looks, when Andrew was doing it, like it would all go in a straight line. Even that, like if I go along here and I'm just taking the tiniest bit off, at the end of it, it's not a straight line and I don't see any way of getting it straighter.
I'm not sure I'm putting Cassie at ease. So, with a quick cut here and a chop there, we're ready for the presentation.
I didn't cut off any ears. There's no blood. The hair will grow back. I'm going to put down the scissors.
Right, you spin around, grab the chair, hand you the mirror, and you can have a look.
Just what I wanted.
And this is the finished product. Crikey, I hope the jagged looks in fashion.
Andrew, how did we do?
OK, so I think, you're both fantastic, but I think initially, Chris, you started off amazing. Your consultation was great, Xand. I think you actually said at one point, I'm a bit nervous.
I did.
And that wasn't a good start.
Wasn't what she wanted to hear.
Yeah. However, I think, Xand, your technique was a little bit better than yours, Chris. You cut a straighter line, and with yours, Chris, you didn't use the client's back as a guideline.
So what's the overall verdict?
Well, I think the overall winner is it just really has to be Xand.
Yes!
Well, we may have learned that you are a tiny bit better than me in some aspects of hairdressing. But what we've definitely seen is just how important the hospital hairdresser is in making patients feel good. This is most definitely a job best left to the professionals. Andrew, we're handing our aprons back.
Thank you very much.
Thank you very much indeed.
This is Operation Takeover.
Are you ready to guess who today's hero is? Well, I'll give you some clues. They spend a lot of time dealing with people on one of these. Hello? And they have to... Hello, Doctor Surgery?
Chris, is that you? I'm trying to book an appointment for Mr. Grumbles.
Where are you? We're meant to be doing an Operation Ouch takeover.
Well, that's handy because I'm right here. Come on, Chris, let's go.
There are nearly 3,000 doctor surgeries like this in the UK, each one seeing hundreds of patients a day.
All these appointments have to be booked in and organised by the hard-working reception staff.
We're about to take over the job of today's hero, reception manager Vasanti.
Vasanti speaking. How may I help you?
Vasanti's busy reception receives around 150 phone calls every day.
You are, for lots of sick people, the first person they encounter, and you are trained to make a decision about how they get help.
Reception staff have to try and extract as much information as they can from the patient, and then it's for us to decide, does this person need to see a doctor? Is it something the nurse can deal with?
What are the most important skills to have as a receptionist?
It's being able to use your own initiative. It's difficult dealing with challenging patients.
Do they get annoyed at you?
They do. We are the first port of call, and they seem to take all their frustrations out on the reception staff, yes.
Yikes, Chris. I think we ought to get some training.
The first thing is obviously greeting the patients. I would, for example, say, "Good morning, Vasanti speaking. How can I help you?"
Great.
We've also got to get to grips with the appointment system. Got it, Xand?
Which button was that?
This is tricky.
We've seen just how important and challenging the job of a GP receptionist really is.
But will our attempts to do it be met with a frosty reception?
It's time for us to take over as surgery receptionists.
We're going to be judged on
Prioritising appointments or triage,
organisation,
and our manner when dealing with patients.
Dr. Xand's cure-all house of wonder. We can fix you. And no, that is. What are you doing? What are you doing? I'm just practicing my phone manners.
We'll each have 4 fake patients to deal with. First up is a phone call.
Hello?
Hello, is that the doctor's surgery?
Yes, it is. Yes, sorry, this is the Doctor Surgery, and it's Dr. Chris speaking.
Oh, I'm not happy how he answered the phone there.
Oh dear, Chris, that's not a good start.
OK, Xand, let's see how you do.
GP Surgery, Xand speaking. How can I help you?
I need to see a doctor urgently today, please.
Could I get your date of birth, please?
Well done, Xand. You got important patient information.
Now, would an appointment at 11:48 this morning be OK?
He's just offering the appointment without finding out what the medical reason is. It's the only appointment left of the day, which is gold dust.
Watch and learn.
What is the problem?
I feel really, really unwell. I just need to see a doctor today.
It does sound like you should come in for an emergency appointment.
Ooh, you sure that was an emergency, Chris?
I don't know if I should have done that.
Time for patient number 2.
What can I do for you?
I need to book an appointment. I have a very bad back pain.
Uh-oh, the phone is ringing.
I'm going to have to answer this call.
Feeling the pressure, Xand?
I'm sorry about that.
He should have finished with the patient he was dealing with rather than answering the call.
Do you mind if I just take this? I'm really sorry. Hello, it's Chris here. Dr. Chris here.
Look out, Chris. Here comes patient number 3.
I'm going to miss my appointment.
What's your name?
Serena Marquez. you're over an hour late for your appointment.
I'm probably a bit late now because I'm standing in this queue for a minute.
Yeah, Chris.
So do you mind just waiting while I deal with this gentleman?
I think he's feeling stressed now.
I'll show you how it's done.
If you have a seat, we'll get you in very shortly. I'm just going to deal with this gentleman, but you won't miss your appointment.
She doesn't look impressed.
Can you give me your full name, sir?
He has asked the patient 3 times now for their name.
So I think the best thing to do, I can make you an appointment in a couple of weeks.
Okay, yeah, whatever. Yeah, it's fine.
Finally, patient 4 arrives. She needs an emergency appointment.
But we've both filled all the available slots.
I've been feeling really, really faint, and I've fainted for the last couple of days.
This is why I need to see if he's going to prioritise.
There are no emergency appointments left here today, so you can't see a doctor here today. If you have a seat, I will have a chat with the doctors and we will have to squeeze you in this morning.
Thank you.
Wow, that was hardcore. Time for the verdict.
How did we do?
Your triaging skills are very similar. You both gave the last appointment to the first patients. And I think for both the patients, it wasn't an emergency. Your mannerism was very good. You're both similar. When it came to organisational skills, I felt Xand was much better.
Really?
What?
You used your initiative to squeeze that patient in.
Did you send her away?
So the winner is... Ta-da!
Yes! I have to say, this will not be a job I'm applying for anytime soon. I actually found it very stressful. I think what we've learned is that it is a job much better left to the professionals.
We should take apart receptionist jackets.
Basanti, thank you very much indeed.
Thank you.
This is Operation Takeover.
Today we're meeting 3 heroes from the maintenance team, starting with engineer Adam.
The maintenance team keep everything in working order here at Alderhay.
Adam, what does that involve?
Everything from ventilation to anything in between, toilets, lights.
What's on the menu today?
The next job is a code brown.
Hang on a minute.
What's a code brown?
Well, you're about to find out.
I'm so jealous. Chris is getting to do a code brown, whatever that is. He always gets all the best jobs.
This is a code brown.
Oh, it's poo!
Oh, no.
It's not the most glamorous job, but it's got to be done, and you've got to keep the hospital operational.
Hold on a second. That looks like tea bags. Have you made up this code brown specially for me?
Well, we might have done, or someone's been eating tea bags.
Huh, nothing like a nice cup of tea, Chris. Ugh.
OK, so show me how you unblock the toilet.
Put the plunger in, cover the hole, and you
Get to it, Chris.
You're giving it some, aren't you?
Stop leaving it all to Adam.
You're gonna...
flush the test, and there you go.
Brilliant job. Very impressed.
You big wimp. Leaving the bowels of the building, there are plenty of jobs to do on the outside too, and one of them involves a secret weapon. Meet Jay, our second maintenance hero, and his Harris Hawk, Leo.
What is Leo's job at this hospital?
Basically, a deterrent to the pigeons. Queer's job is to stop the pigeons from living on site.
And why don't we want pigeons living on site?
We don't want them to be pooing into the filtration systems for the hospital.
Right.
Obviously, it's a sterile environment and we want to keep it clean.
So you don't want poo in your air conditioning system?
That would definitely be a code brown, Xand.
Jay releases Leo to fly around the hospital. As a bird of prey, he scares off the pigeons and other birds so they disappear sharpish.
OK, here he comes. Wow.
Now it's my turn, and I'm a little nervous.
I actually feel genuinely quite terrified. He's going to land on my hand, we hope.
Well done, Xand.
He obviously likes you.
This is completely magical. I think you've got the best job in the world, Jay. Good job, Leo.
Now it's time for the challenge with our third maintenance hero, Ian.
Ian, tell us what our challenge is.
For today's takeover challenge, we're going to head to the roof.
The roof at Alderhay is a 24-metre-high eco-roof, full of wild flowers, and just like other gardens, this one needs to be weeded.
It's a very special roof, and it needs maintaining in a very special way, and that's via abseil.
Yikes!
To make it a fair challenge, Ian has planted 5 dead flowers for us to collect, whilst lowering ourselves down on special safety ropes. He who collects the most flowers wins.
It's head-to-head extreme gardening.
OK, let's get ready.
We need the right gear and the right skills.
Ian and his team do this all the time, but we have to learn the ropes to keep us safe on the steep and highly dangerous slopes of the hospital roof.
Old Dr. Xand is just going to have to rise to the occasion. I think I'm going to come out of this smelling of roses.
Son, Bruce, this way. Not a good start.
I'm off, and let me tell you, I know a thing or two about flowers.
Oh, look at that, there's some red campion. You don't see that very often. There's a couple of ribwort plantain. Of course, that's a perennial herb found all over the UK. Oh, no! I've missed one! No! Got to pay more attention.
Right, now it's my turn.
Ready?
My plan is to focus and get the job done.
Lock it off.
This is easy. That's my first one in the bag.
Next flower.
And my second is not far behind. What about you, Xand?
I've got my first one! There's no stopping me now.
2 down. And hello, flower number 3.
Hang on, Xand. I'm right behind you. Focus. Focus. Ha-ha! I'm storming ahead now. One more to find.
Some knapweed, a few cornflowers. Oh, I almost missed that one.
I really need Chris to miss his final flower.
Too late. I've done it.
I think I can still win. Surely Ian will be impressed with my flower knowledge.
Let's see, shall we?
Ian, how did we do?
It's got to be the man that had his mind on the job and collected all 5 flowers, Chris.
Yes! It shows the importance, Xand, of staying focused while you're working in a hazardous environment. Now, we've seen how important the work is of Ian and the maintenance team in keeping the building looking great and working well.
But you know what, Chris? Even you didn't do a perfect job. I think work like this is definitely best left to the experts. Thanks very much, Ian. We had a brilliant day.
Thanks, guys.